Now, AFSOS has recommendations on non-conventional or complementary medicine. Perhaps you could tell us about it briefly. And then we'll have discussions after. Yes, I decided to. I was expecting to speak to you about this. One of the major successes of alternative medicine in France, particularly if you look at what's happening in this field, there were several attempts made, which were a flop. Quite a few ideologies and so on. Because with alternative medicine, there are certain things which are very suspect in the eyes of the cancerology community. They feel that it's all about grandmother's remedies. But things do change. And just to give you a clear idea, let's talk about physical exercise. You know, it's all very fashionable. Physical exercise became very fashionable in the Paris area several years ago, and a lot of people were looking at it in greater detail. Thierry Bouillet was a pioneer in it, and he had started with martial arts use for cancer patients. At the time, of course, I had giggled, I had mocked him, and these oncologists were invited, you know, by some of the public authorities, maybe the Ministry of Health itself, and they were very proud of their success. It was just the start of this new adventure because they felt that they were really doing something for their patients, being really useful. But they were quite shocked because they were invited to give an explanation to these public authorities to explain why they were getting into this sect-like practice. And anyway, that was just in passing. A cult or a sect is how they were treated. And I would say that in France, as far as alternative medicine is concerned, this is something that always leads to a fight in any discussion. Because when you're talking to so-called officials, you must warn people that they should avoid going into any kind of sect or cult practice. So it's a very ideological vision, you know, of the so-called official medicine or of any alternative practice, which generally are considered as being rubbish. So all this was just put on the back burner or just completely banished from the scene. But these were some of the practices that we found. Most of this data came from our American colleagues at the time. And some colleagues I spoke to a few years ago had said that it's interesting, but we can't use it in France because there's no French data. So generally, we have the same concerns, the same problems as other countries in the world. However, there is a problem in France. Is this absolute devotion to homeopathy. Apart from that, there's also a great use of food supplements. And food supplements, a lot has been written about them, but by and large, as opposed to what the patient might imagine, you find the most useful foods in your plate. So it's better to just eat the right food than popping a magic pill. So you sometimes have an overconsumption, as you see. As you heard in the earlier presentation, patients do consume a lot of food supplements, and we do know that there's a major doubt about the innocuity of these antioxidants in cancer patients. There's an excellent general overall review by Watson in Open Biology, who looks at the entire rationale about the role of antioxidants regarding the incurability of cancer. And Watson concludes by saying that if you give antioxidants to patients, you are perhaps killing more people than saving them from it. So because there's no information, because there's no reflection as such on the subject, there's been an overconsumption of vitamins and antioxidants just in the general public. Because it's an OTC, it's just an over-the-counter drug, and cancerologists are just not interested in it because they feel it serves no purpose. It must be innocuous, and patients like it, but that's not true because they can be extremely dangerous.
So, diets were there's been a fad of late for fasting, therapeutic fasting. So in the press, in the media, you may have heard that there was to be a clinical trial in our hospital, Avicenne Hospital. Actually, it wasn't that. We were just coordinating. But it was hell for me for a whole year because the information actually went viral online, and I get phone calls from people who want me to actually supervise their fasting, and there's quite a few patients, actually more than one might suspect, more patients than one might suspect that fast. Let me remind you that the only publication we've had so far, even though there are 5 clinical trials on the way within the NCI database, is the one by Walter Longo. It's a series of case reports in the aging review. So if you search on Medline, I can't remember the date, but there's about 10 patients, but not one fasted the same as another, and not 2 have the same cancer or the same treatment. So, and it's only on the basis of this series that there was really a worldwide buzz around therapeutic fasting. And we sometimes forget that the first real scientific paper about therapeutic fasting dates back to the 50s, and it demonstrates that there is no effect on the biology of tumors. So it's a lot more complex than one might think. But it's very, in fashion at the moment. And I think physical exercise, we've discussed it at length today, so it's certainly one of the most interesting complementary practices. And there's always that irrational fear from the regulatory authorities, which is that patients with cancer might actually completely take to and get involved in complementary medicine and lose sight of their treatment. I think maybe it's happened once a year. I only run into patients who actually do that once a year. It's very rare. I'm not saying it's non-important, but more than 80% of patients will use the so-called alternative medicines as a complement to have better control of side effects and enhance their quality of life. So you have to look at more advanced statistics, and there was at least one paper on this. If you look at more advanced statistics, there's a few patients who, for lack of a better solution, will turn to complementary therapeutics to find cure, where our type of medicine can't offer them a cure. There have been multiple experiments, and there's a strong ideological component in that, because one of the first attempts to get recognition for these complementary medicines happened in my university in Bobigny in the Paris region. And to keep it simple, I'd say that it was marked by sort of form of protest in the 1960s, late 1960s, and under the aegis of the dean in the early 80s, our university decided to have one course actually, and one course actually was open to non-doctors, which is not a problem for me, but to non-health professionals, and we had a butcher, for example, amongst us, who started to get really interested into phytotherapy. No, it really happened. So it was a university diploma in natural medicine. There were 13 university degrees that had pretty much everything you could think of in terms of complementary medicine. So it was very innovative back then. Currently, we've had to clean up a bit. There are 4 university degrees left. So around auriculotherapy, osteopathy, and those are complementary medicine where we have varying levels of evidence. So we've cleaned up. And when at that same time there were people lamenting the fact that we were cleaning up and getting rid of so many courses, well, we launched a strategic plan to get recognition for complementary medicine. It was a very important strategic plan, and I would say that currently the only part that's left is the creation of a Chinese Medicine Center in the 13th arrondissement in Paris. So you could argue that what motivated that creation is disputable, but it is there's suffice it to say that there was this attempt at proper recognition for complementary medicine, and the whole medical body actually that created an uproar. You know, they said, "Are you mad? You want actually those folklore type of medicine to get proper financing, and when we don't have enough resources for our type of medicine, for radiology, for general medicine." But there's something we can learn from that, is that we sort of did what that famous character in Molière's play did. We actually got involved in complementary medicine in spite of our own will, without being aware that we were doing it. So and there's also sophrology, hypnosis, and other things that are, some more useful than others. So clearly the institutions, the establishment, clearly rejected that, even though it was a gradual and sort of underground process. And, oncologists in the 70s would actually work in the surgery department, and when the surgeon couldn't do anything anymore. That's what oncologists did back in the day. So clearly complementary medicine exists, but there's no real structure for it. So the point was to give it structure, to give it some kind of certification, to have degrees, and that was not done. So it's still a bit of a mess. And I would say that there are two obstacles, two stumbling blocks that have remained in our relations with the authorities. There's the question of ideology and pragmatism. And in the end, our patients move towards complementary medicine. So our choice is, do we want to make it possible for them to do that in good conditions? Because it's our duty to actually supervise that and to tell them, well, those are types of complementary medicines that actually are backed up by evidence, and we know that it's safe. And there are other types of complementary medicine that we recommend you don't use. And we can't do that notably for ideological reasons, because some people think it's contrary to their dogma. And there's another problem, and that's, I speak from experience because we've had 30 years of complementary medicine in our hospital. There's a bridge that was never built. Practitioners of complementary medicine usually do it in the private sector, in the community. And it's not the same culture we have in hospitals. It's pretty isolated. The research culture is different. And teaching hospitals have not really tried to get interested in trying to inject a certain degree of methodology in the assessment of those complementary medicines. So 30 years down the line, a great number of complementary medicine units died down in university hospitals. And it's been like that for 30 years, and nothing's changed. We've had the same people doing complementary medicine in town, and there's never been a bridge built between hospitals and that private practice. But we can still draw some lessons from this. I'd like to wrap up on a positive note. We mentioned physical exercise. Well, I'll give you the example of the CAMI body, which is the structure, that the body that really made a lot of effort to actually give structure to physical exercise on a national scale, which goes to show that there can be recognized bodies that are involved in complementary medicine, but in safe conditions, with practitioners or people who are not doctors, but who are trained and who all go through a university degree in physical exercise, in oncology. So I really think it's possible to make for a better organization of complementary medicine. And what you said in introduction, so the loop is looped, so to speak. The AFSOS, the French-speaking Association for Supportive Care in Oncology, has played a role in trying to set out standards, and we're beginning to see emerging in France guidelines and levels of evidence for practicing of complementary medicine. It's developing in some hospitals. I wouldn't say it's going to take the form of complementary medicine centers the way it's done in North America, but it will be supportive care units, more or less loosely linked to the oncology department with sophrology, hypnosis, but we do not have complementary medicine departments as it is the case in other countries. But that it took us decades before getting there. Thank you for your attention.